Imagine waking up one morning with a dull ache in your lower back that you assume is just another bad night's sleep. Maybe you sat too long, maybe you lifted something awkwardly, but days pass and the pain doesn't leave. Instead, it creeps down into your leg, shoots like electricity when you bend forward, makes sitting unbearable, and suddenly simple things like tying your shoes or getting out of a car feel frighteningly difficult. And this is often how a herniated disc, commonly called a slipped disc, quietly enters someone's life. Not with drama, not with warning, but with persistence, confusion, and fear. And across the USA and UK, millions of people experience this every year. Many of them told conflicting stories, rushed into scans, frightened by words like bulge, nerve compression, or degeneration, and left wondering whether they need surgery, injections, lifelong painkillers, or whether their spine is permanently damaged. And the truth is, both simpler and more hopeful than most people are ever told. Because a herniated disc is not the end of your spine, not a life sentence, and not automatically a surgical problem. But to understand that, we first need to understand what a disc actually is and why it misbehaves in the first place. Your spine is not a rigid pole. It's a beautifully engineered column made of bones called vertebrae stacked on top of each other. And between these bones sit soft, shock-absorbing structures called intervertebral discs, each disc acting like a cushion, allowing movement while protecting the spinal cord and nerves. And each disc has two main parts: a tough outer ring called the annulus fibrosus, and a soft gel-like center called the nucleus pulposus. And when we say herniated disc, what we really mean is that the outer ring has weakened or torn, allowing some of that inner gel to push outward, sometimes pressing on nearby nerves. And this pressure, combined with inflammation, is what causes the pain, numbness, tingling, or weakness people experience, not the disc itself being out of place, which is one of the most common and misleading myths. Because discs don't actually slip like soap bars, they bulge or herniate due to stress, wear, and biological changes over time. So why does this happen? Why do some people lift heavy weights for decades without issue, while others develop a herniated disc seemingly out of nowhere? And the answer lies in a combination of factors rather than a single cause. Because age plays a role, as discs naturally lose water content over time, becoming less flexible and more prone to small tears. But age alone is not destiny, because lifestyle matters deeply. Prolonged sitting, especially with poor posture, increases disc pressure. Smoking reduces blood flow to spinal tissues, impairing healing. Obesity increases mechanical load. Weak core muscles reduce spinal stability. And sudden, unprepared movements, like twisting while lifting, can be the final straw that reveals an already stressed disc. And genetics also contribute, meaning some people are simply born with discs that degenerate earlier, and understanding this is important because it shifts the narrative away from blame and toward prevention and management. Symptoms of a herniated disc vary dramatically depending on where the disc is located and which nerve is affected, because a disc herniation in the neck can cause neck pain radiating into the shoulder, arm, or hand, with numbness or weakness in specific fingers, while a disc herniation in the lower back, which is far more common, can compress the sciatic nerve, leading to classic sciatica, a sharp, burning, or electric pain that travels from the lower back through the buttock and down the leg, sometimes reaching the foot. And people often notice that coughing, sneezing, or sitting worsens the pain, because these actions increase spinal pressure. And it's important to understand that pain severity does not always correlate with disc size, because a small herniation in the wrong place can cause severe symptoms, while a large bulge elsewhere may cause none at all. One of the most damaging moments in a patient's journey often occurs when imaging enters the conversation, because MRI scans are powerful tools but dangerous storytellers when misunderstood, and many people are told they have disc degeneration, multiple bulges, or severe changes, words that sound catastrophic. Yet studies consistently show that a large percentage of people with no back pain at all have disc bulges or herniations on MRI, especially as they age, meaning imaging findings must always be interpreted alongside symptoms, not in isolation. And this is where unnecessary fear and overtreatment often begin, because once someone believes their spine is fragile or broken, they move less, tense more, and ironically prolong pain. So what actually works when it comes to treatment? And this is where evidence becomes reassuring, because the vast majority of herniated discs improve over time without surgery, often within weeks to months, as the body gradually reabsorbs the herniated material and inflammation settles. And the cornerstone of recovery is not bed rest, not aggressive manipulation, but controlled movement, education, and reassurance. Because prolonged rest weakens muscles and stiffens joints, while gentle activity promotes circulation and healing, and pain relief medications like anti-inflammatories can help in the short term, but should not be the only strategy. And physical therapy plays a central role, focusing on core strengthening, posture correction, movement, confidence, and gradual return to normal activity, not just passive treatments. Lifestyle modification is often underestimated, but profoundly powerful, because weight loss reduces spinal load, smoking cessation improves disc nutrition, regular low-impact exercise like walking or swimming maintains mobility, and learning how to lift, sit, and move with awareness protects the spine long-term. And psychological factors matter too, because fear, stress, and catastrophizing amplify pain perception through real neurological pathways, which is why patients who understand their condition and feel in control often recover faster than those who feel helpless. And this is not pain being in your head, it is pain being influenced by your nervous system, which is biology, not weakness. In some cases, symptoms persist or worsen despite conservative care. And this is where more advanced options come into play, such as epidural steroid injections, which can reduce inflammation around the nerve and provide temporary relief. Not a cure, but a window of opportunity to engage in rehabilitation and surgery, which, despite its reputation, is usually reserved for specific situations, such as progressive muscle weakness, loss of bladder or bowel control, or pain that remains debilitating after adequate conservative treatment. And even then, surgery is not about fixing the disc as much as relieving nerve pressure, and long-term outcomes between surgical and non-surgical treatment often converge over time, meaning the decision must be individualized rather than rushed. One of the most important truths patients need to hear is that having a herniated disc does not mean your back is permanently damaged, does not mean you must avoid movement forever, and does not mean your life is defined by pain. Because spines are resilient structures designed to adapt, heal, and strengthen when used appropriately, and the goal of treatment is not just pain relief, but restoring confidence in movement. Because a pain-free but fearful spine is still a disabled spine, and the most successful recoveries occur when patients move from asking, "What's wrong with my back?" to "How do I make my back stronger again?" Modern medicine is slowly shifting away from fear-based narratives toward function-based care. But this transition requires informed patients who ask the right questions, who understand that scans are tools, not verdicts, that pain does not equal damage, and that recovery is a process, not a single intervention. And this perspective matters more than any pill or procedure, because back pain is one of the leading causes of disability worldwide, and how we talk about it shapes outcomes at a population level. So if you or someone you love is dealing with a herniated disc, remember this: your spine is not broken, your future is not fixed, and improvement is not only possible, but likely with the right approach, patience, and guidance. And if this explanation helped you see back pain with more clarity and less fear, And if you want more honest, evidence-based medical insights that empower you rather than scare you, then make sure you subscribe to MedLogic, because this channel exists to cut through medical myths, explain complex conditions simply, and help you make better decisions for your long-term health with confidence.